Classes is a continuation of Unit 7. This is on the integumentary system. Integumentary system is your skin, by the way. Remember these points about the integumentary system. It is a natural protective covering. It's the largest organ and body system. It covers and protects the body. It is a sense organ. It regulates body temperature, consists of skin, hair, nails, glands, fatty tissues, and nerve endings. Normal changes of aging in the integumentary system. Amount of fat and collagen decreases. That's why in elderly they have sagging skin. Elastic fibers lose elasticity. That's why we get wrinkles. Hair and nail growth slows. Skin becomes drier and thinner. That's why we have to, so they're very prone to lacerations and skin tears. That's why we don't wear long fingernails or jewelry that could potentially cut their skin. They also bruise easily. They have lost the protective fatty layer, and that's why they feel colder. Sometimes you're wondering how they can have on so many layers of clothes, and it's because they've lost that protective fatty layer. And so they bundle up with sweaters and layers of clothes. Their hair thins and turns gray. Shingles is, the picture didn't work. Let me see. No. Shingles is a viral infection caused by the same virus that causes chickenpox. It results in pain, itching, rashes, and possibly fever and chills. If you've ever seen shingles, you'll kind of remember what it looks like. Somebody shows you, it's just a red rash, and it's painful more than it is itchy for the resident. Immobility means somebody who does not get up, walk around, move around. They are immobile, right? There are problems with immobility. It decreases blood that circulates to the skin. It increases the risk of skin breakdown. And breakdown occurs over bony prominences. Pressure points are areas of the body that bear much of the weight when it's sitting or lying. And bony prominences are areas of the body where the bone lies close to the skin. So this is just showing some of the pressure points that you have to kind of watch for redness. If somebody lays in the same position too long, at first it will start getting red, but if it's too long and their skin is so fragile, they'll actually end up with sores. So pressure ulcer is what that's referred to. You may hear them called a pressure sore, a decubitus ulcer, or a bed sore, but they are all the same thing. There are 4 stages of pressure ulcers. So stage 1, where the skin is still intact, you see some redness there and maybe some swelling. It may feel warm, but the skin's not broke through. And usually, if it's red like this and it goes away in 5 or 10 minutes, then it's not a big concern. But if it stays red like that, then it is stage 1. It's not like they're not relieved within 15 to 30 minutes after removing the pressure. Stage 2, you can see it's gone beyond redness. It's broke through the skin a little bit. There's a little shallow crater or blister type thing. The skin around it may be discolored. There is no dead tissue or site at this stage. Stage 3, it's full thickness. It starts to look more like a crater. The bottom of the wound may have yellow dead tissue. It may extend into the muscle a little bit. And usually a stage 3 will take weeks or months to fully heal. So you don't want to get them to that stage. You guys need to be reporting when they're red, and there's things they can do to put on to prevent them from going to stage 3. And then stage 4 is a bad one. Full thickness skin loss with possible exposed muscle and bone. Looks like a deep crater. Sometimes they kind of tunnel. They have some necrotic tissue. It usually takes months to get a stage 4 wound healed. They can get this, a lot of times they'll get MRSA or infections in those wounds too, and sometimes it requires a skin graft to heal. Risk factors for pressure ulcers include the following: immobility. We want to try to get all the wrinkles out of the sheets. Crumbs or anything irritating in the bed. I've seen people leave like the little things to do blood sugar checks, and they leave them in the bed or something like that, and then they end up with a sore. Malnutrition or dehydration, urinary incontinence. There actually is something called urinary blisters from people sitting in their urine too long. So it's important to make your rounds, keep people dry. And a lot of people will, if they're only wet, not wipe the urine off, and you really should wipe the urine off. That doesn't need to stay on their skin. It will cause redness. Frequent causes also for skin breakdown is shearing, friction, and moisture. So shearing is when the skin and the bone, they're kind of sliding down, and that can cause the skin breakdown there. Guidelines for preventing pressure ulcers. Report any changes in the skin, perform regular skin care, and closely observe the skin. Keep the skin clean and dry. So I can't stress it enough. Just because they only pee does not mean you don't wipe the urine off. They need to be turned every 2 hours, so they're not in one position too long. Ask the resident in wheelchairs to change their position often. Avoid rubbing skin against surfaces during transfers.